Thank you, everyone, for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic. I'm Greg Phillips with Duke Communications. The emergence of the highly transmissible Omicron variant has reinforced the need for testing in schools to contain the spread of the virus and keep classrooms open. With us today to discuss how best to manage that is Dr. Danny Benjamin. He is a distinguished professor of pediatrics in the Duke School of Medicine and co-chair of the ABC Science Collaborative, which has been studying in-school transmission of COVID-19 to understand how schools can remain open safely. Dr. Benjamin, good morning.
Hey, good morning, Greg. Thanks for having me.
Thanks so much. So we'll jump right in here. We're going to be talking a lot today about test to stay. Can you tell us briefly what that is and why the ABC Collaborative studied it?
Sure. So the universal good of test to stay is that it safely reduces quarantine, certainly in the universal mask setting in schools. But when people talk about test to stay, there's kind of three common forms. One is widespread test to stay, where all the attendees are universally masked in school. This was recently endorsed by the CDC. It was published in the MMWR in December. And this is when, Greg, you and I are in school, you're wearing a mask, I'm wearing a mask, I'm infected. We sit next to each other in third grade classroom, and we know that I become infected, I have to go home. You are exposed. Back in September, in many school districts, you would have to go home for quarantine. Now, about 2/3 of the school districts, by our estimate in the United States, were not sending those children home, but that was CDC guidance as of September, October. Many school districts were not following it, even those that were doing universal masking. That overwhelmed kind of quarantine. And so what was done in December was those exposed children, like you, would have been tested at school the day the school was notified, and then three times after that. And as long as your tests were negative and you were asymptomatic and you wore your mask, you could stay in school. The drawback to this, especially with Omicron, is that the amount of testing that's going to need to get done in every school is going to be 100 or more children in some of these larger schools and some of these large school districts. And so this is impractical. And in many schools, the policy is just going to be insurmountable with respect to logistical hurdles. Children are going to be quarantined because the schools can't handle the volume. And the other drawback to this approach is that children eat at school. And while eating, they are masked, and thus thousands of healthy children nationally who should be in school are still going to be quarantined each day under the current study or current way that this is being advised. So what we did in part at the ABC's Science Collaborative and with North Carolina.Du is we did focused test to stay. We said, okay, if everybody is masked, you don't have to test, you don't have to leave school, you don't have to quarantine. But if you are unmasked, in a universally masking district, unmasked for a brief period of time, for example, at lunch or at basketball practice or what have you, then you could do a test to stay. And in that briefly unmasked school setting, the risk of transmission was about 2%. And with this low risk, children are allowed to stay in school. Even when one of the participants or both are unmasked, the infected child is sent home. This reduces testing by over 90%. Transmission is still very low. It's approximately 2% with the Delta variant. And it also reduces by 90% the children who are quarantined. The third way to do test to stay is when the attendees do not wear a mask. And that study just opened to participation to school districts in North Carolina. We should have those results a month from now.
Gotcha. Absolutely. Thank you. So just to go back here, we talked about the different kinds of tests to stay, but based on what you've already studied and what you found, what is the kind of the top level finding that you have here that, you know, schools, as they're considering how to approach this, need to take away from the research that you just did?
Yeah. So what schools can do is, if both children are masked all the time, they don't actually have to do testing. Those children can just stay in school. And that's consistent with North Carolina guidance. But for school districts from throughout the country, they can use the North Carolina example in that regard. The second thing is, if students are in a universal masking district and they have a brief period of time when they are unmasked, for example, lunch, now if they are exposed to COVID, they can stay at school and they don't have to quarantine. They can do test to stay at school. They just test, stay masked, asymptomatic, they stay in school.
Sure, absolutely. Thank you for recapping that. And thanks to everybody who submitted questions. We've got a number of questions on a practical level about how this will work. But before we move on to those, Dr. Benjamin, could you talk a little bit about the scale of this study? How many schools, how many participants you looked at, and who the participants were, broadly speaking?
Right, so the first interim analysis that just got sent to DHHS, North Carolina Department of Health and Human Services, was 5 school districts and a charter school. Since that interim analysis time, which included 400 children, we've enrolled a total of 1,100 children. But we wanted to have this interim analysis sent to DHHS because the results are so compelling. The results from the 1,100 children have not been formally analyzed, but the results are looking very similar.
Sure, absolutely. Thank you. I appreciate you kind of readdressing that, because obviously this is complicated stuff and we want to make sure it's as clear as possible. And one question we've had come in, saying to what you just said, is just to make it very clear, you're not suggesting that children who test positive for COVID should remain in school, but just the children in which they have come into contact in these masked situations.
Right. The positive child goes home, the exposed child gets to stay. And the exposed child gets to stay for as long as their tests at schools are negative and they remain asymptomatic. And they can get the test done right there in the nurse's office. And under the testing that we used, any adult can give the test to the child.
Sure, thank you for that. And that actually leads us nicely into some of the questions we had submitted ahead of time about how the testing will work from a practical perspective. So one of the questions that we've had here is asking who would administer the test. So as we look at test to stay in school, is this something that we're expecting school districts would implement, as you say, where people would get tested there at the nurse's office, or how active would parents need to be if their child was staying in school under this kind of test to stay protocol?
Great, that's why it's called test to stay. The children, when the family gets notified, the children can stay in school that school day even and get tested that day at the school. Now, not every school has a school nurse, and the beauty of the program is several fold. Number one, any adult who's a school employee who's trained in the test, takes about 15 minutes for training, any adult who's trained in the test can administer the test, and that can be done at school. This is not to be done testing at home. The second thing that's very nice about this is that day 5 or 7, the kind of the last test, if you will, that can be done at a day approximately 5 to 7. If Friday falls on day 5, you can do testing on Friday. If day 5 falls on Saturday or Sunday, after exposure, you can do that on Monday. So the school tests the child at the very least on the day that they're notified and at day approximately 5 to 7 after notification. And that exposed child gets to avoid quarantine. All testing gets to be done at school. They just need to leave their mask on.
Sure, absolutely. Thank you. And obviously, you were just looking at the science here, but one of the questions we've had, which maybe you could speak to, is that President Biden has announced more testing, in the new year, more test availability. Do we have a sense yet of the capacity of schools to actually conduct this kind of in-school testing in terms of getting the tests and the cost of the tests and so on?
Well, North Carolina DHHS is probably the better source for North Carolina schools specifically, and each Department of Health and Human Services should have that answer for each state. But from looking at the amount of tests in the school testing program, it appears, looking as an outsider, that North Carolina has those tests and should be able to complete this. The nice thing about the very low transmission is that it allows us, rather than having to do 4 tests, which was done in the Illinois study, this showed that 2 tests alone one or two tests alone is sufficient. Now, Greg, there's some kind of bits of bad news. One is that in athletics, the number of exposed children, they were only about 10% of the exposed children here, but they were over 50% of the positive children. So school district leaders will have some interesting decisions to make about how to handle this with sports for both school district leaders and for policymakers, especially with the indoor sports of the winter season. The second thing to keep in mind, Greg, is that we did have data from when the Omicron variants start to emerge in the United States. So during the study, which was conducted all the way through December, we've continued to actively enroll children through the month of December and to do follow-up of those children when the Omicron variant was circulating. And with the Omicron variant, the transmission was a little bit higher, but was still less than 5%.
Sure, absolutely. And thank you for bringing that up, because we've already had a number of questions about how Omicron might change your recommendations. And obviously the sense I'm getting from you here is that you're still gathering data on that. Is it possible that you might issue any kind of revised or updated findings kind of once you've had the chance to look at this while Omicron has been circulating in schools in the new year?
Yeah, I think our preliminary findings stand, which is that this is a safe way for schools to proceed, and that these findings, although the data are much more limited, these findings will apply to Omicron as well. The unfortunate thing is that we don't have quite as many children enrolled under the Omicron variant. And so the update that I would anticipate us giving would be just simply greater certainty with respect to that finding. We've greater precision in our estimate of how much transmission is occurring. Because with a secondary attack rate of 4%, which is about what we're seeing with Omicron right now in the first pass of the data, that's still a very, very low secondary attack rate. And we did not see tertiary spread. Greg, tertiary spread is what's really feared in these school districts, right? I'm infected, I'm the primary case, I come to school, I expose you. If you get infected, you're the secondary case. The secondary transmission here was only 2% for Delta, approximately 4% for Omicron. What's feared is the tertiary spread, Greg. That is, you go on to infect your peers at school. There was no tertiary spread for either the Delta variant or the Omicron variant. So that means I come to school infected, I have, if I come to school infected and I'm around 100 different children, and they are all close contacts, which would be extremely unusual for me to have 100 close contacts at school. But in that circumstance, the secondary attack rate would still be only on the order of 2 to 4%, and no tertiary attack rate, even if those children got infected. And Greg, remember, this is, I'm infected, I go home, I expose you, you get to stay in school. And Greg, during the time of exposure, what differentiates this from the CDC findings and the current CDC recommendations is I don't have my mask on when I expose you. For example, we're eating lunch together. So I don't have my mask, you don't have your mask. Those children were excluded from the Illinois study published in the MMWR on December 17th. Those children were the focus of this study.
Sure, absolutely. Thank you for all that additional context. One quick question we've had in, you've talked about the testing and that the testing could be done in schools. Are you talking specifically, are these rapid antigen tests that you're talking about?
That's correct.
Okay, gotcha. Okay, just want to clarify that. Thank you. Obviously here we're looking at North Carolina. As you said, you've been studying schools in North Carolina, kind of in partnership with the state. Do you know if there is any kind of a timeline for the state to consider your findings? Is this something that they're looking at? What do we know about whether the state will adopt your approach or be looking at it as they revise their guidelines moving forward?
Well, the results were just sent to DHHS, and of course, they partnered with us in the design and interim analysis. So they had verbal communication with us on a weekly basis of how things were going in the study, because we had a safety committee monitoring the study. So DHHS should be able to consider these data fairly quickly in their Strong Schools toolkit and incorporate that however they see fit. And then any changes to the Strong Schools toolkit, my understanding is that would then go before the state school board.
Sure, thank you very much. We had an interesting question here, moving beyond schools, we're looking at preschools and daycares. Is this a kind of strategy that preschools and daycares could implement if they had access to testing, or could you see that being implemented at that level?
Yeah, that's a little bit outside of my swim lane, Greg. There's challenges there that are not faced in the K through 12 or pre-K through 12 environment. This study went down to 4 years of age, but with 2 and 3 year olds, you've got just some challenges there that are not present in the pre-K to 12. The next step we think is really, and we're partnering with DHHS on this for next month, is to do this in school districts with voluntary masking. And we should have those results in by February.
Sure, thank you very much. I had an interesting question here. Obviously, this is the holidays, and so people aren't in school. We've had a question asking if a child is exposed at home, can the parents then send the child back to school, provided they're notifying the school, and the school can include those in a test to stay approach, or how should that work?
So under the ABC DHHS protocol that will be open in January, the answer to that will be yes. Now, whether or not the school board or DHHS considers that outside of the terms of the protocol remains to be seen. That's primarily because none of those type of children were enrolled in this study.
Sure, absolutely. Another question, in the population that you studied, did you have any sense of how many of these students were vaccinated versus unvaccinated, and did that kind of affect what you saw in terms of transmission?
Near zero, because I think it was actually none, but there may have been one person who was vaccinated. It's 0 or 1 out of 400. And the reason for that, Greg, is under North Carolina policy, you don't have to, as of December, you did not have to quarantine if you were exposed to COVID.
Sure,
so
absolutely.
For those people, those children and adults could just stay in school. We had one vaccinated adult who, for their own comfort measure, they wanted to participate and they were negative.
Sure, absolutely, that makes sense. There have been a number of news reports over the holidays of outbreaks, including larger numbers of children than we've seen before. How much concern does that bring you that the landscape may be very, very different once students come back into school in January, because obviously Omicron has had these extra few weeks to circulate?
Right. So in the school districts that are masking or doing universal masking, the Omicron should have minimal, in the school districts that are masking, we have data from December comparing Omicron to Delta, and the within school transmission, again, this was only a couple of weeks worth of data. The within school transmission was pretty similar. It's the unmasked exposures that make me a little bit more concerned with respect to transmission with Omicron, because it's going to be moving through groups of people very, very quickly.
Sure, absolutely, that makes sense. We are going to be wrapping up here fairly soon. We've just got a couple more questions that have come in to get through here. And one is just for some clarification. When you're talking about the ABC DHHS protocol, is that the change in policy that you're discussing when you mention the protocol?
So what, excuse me, Greg. I apologize for that. It's not COVID. I've been tested recently, and I've been
glad to hear it.
And I'm vaccinated in accordance with due policy.
Fantastic.
Sorry about that.
Quite all right.
So let's see. So the
The question was regarding when you're talking about the ABC DHHS protocol, is that referring to the change in policy that you're suggesting or what's already in place?
I understand better now. Thank you, Greg. So the policy change will be made in collaboration between policymakers and the folks at the state level in North Carolina. The ABCs only provide the research to help inform that. That research is conducted under a protocol. The reason why it's conducted over a protocol is that quarantine is covered under policy, and the research is an exception to the currently approved policy. Therefore, we had to have a written protocol. It was a study. Families had to provide consent in order to participate. And although no personal health identifying information went to me, the families had to consent to do the procedure. They were then given a random number that identified their child. That random number, along with the test results, then comes back to the researchers. So we can't ever identify the children, but those children are actually in and those families were in a research study where they consented to do the protocol, which was test several times after exposure at school.
Gotcha. Okay, thank you. And again, just to be clear, we've had a question to clarify this. What are the rules in North Carolina for schools right now versus what your recommendations are?
So right now, schools, if, Greg, I come to school and the school learns that I'm infected, I have to go home. If you and I are classmates and we kept masks on the entire time, you get to stay in school. If we are classmates and I exposed you and you're vaccinated, you get to stay in school. But if, Greg, we are classmates and we go have lunch together and I sit within a few feet of you at lunch, then you, Greg, as an exposed, unvaccinated child, you would have to go home and quarantine in the state of North Carolina. If you and I were at recess together and we'd had our masks off, or we were in class together and our masks slipped down and we had a time where we were both unmasked, or one of us was unmasked and I was infected, again, under current North Carolina policy, you would have to go home and quarantine. Obviously, I would go home as infected. What this protocol says is, Greg, I still go home, but you get to stay in school as long as you don't have symptoms and as long as you test a couple of times. And because children eat at school every day, and because there's going to be a whole lot of COVID in schools in January, this is an important finding for children's public health.
Sure, absolutely. And from a logistical perspective, we've had a question about the fact that there's currently a shortage of testing. And if that persists, or if we see it again, presumably that would make this recommendation even more important, because you're talking about using thousands and thousands less tests than under what was proposed by the CDC, correct?
That's right. That's what's really key about this, Greg, is we reduce the amount of tests used by 90%, and we reduce the amount of quarantine by over 90% compared to what the CDC is outlining.
Sure, absolutely. Thank you. Wanted to return briefly to the topic of we had a follow-up question on the topic of preschools, and you mentioned that 2 and 3-year-olds have their own sorts of challenges when implementing this sort of policy. And have you been asked to elaborate on that? Is that just because it's harder with masking with children at that age to keep that in place, or what are some of the challenges there that make it hard to transfer these recommendations?
Yeah, so number one, we had a whole lot of preliminary data coming into this study. We had over a year of data from these school districts giving us the secondary attack rate that was occurring in the on-mask environment. So we knew going in that it would be very low. We knew going in that the secondary attack rate, we could estimate that to be 1%. We knew that we had school districts that had been giving us data for 18 months. So if they had any blip in their transmission, we could see that right away. And so that was the power of the ongoing EPI study that, Greg, we've published before, and that the state of North Carolina had the wisdom to fund back in the spring of 2021. Laid a tremendous amount of groundwork. That groundwork is not there in the preschool environment. Number two, because of our NIH funding, we actually studied in schools with anonymous monitors mask compliance in schools. And you can drive that consistently above 90% with mask over nose, mouth, and chin. Now, some schools, clearly they have a policy and all they have is a policy. But when you see bumps in infections, school districts, we've now outlined and published a way that they can do an intervention to increase the compliance of masking. We knew that we had that information, so we knew how much compliance we were having in these school districts, which is not something that we know in the 2 and 3 year old group. And as you say, for 2 and 3 year olds, masking can be a bit more of a challenge. Number three, Greg, is that the samples, a test result is really only as good as the sample. And some of the sampling can be a challenge sometimes. It's not the sample that goes, we're talking about a rapid antigen, so it's just inside the nose. So it's certainly doable in the 2 to 3 year olds, but the details of that can sometimes be easier with the 7, 8, 12 year old child than it can be in, say, somebody who's 2.
Sure, absolutely. That all makes sense. Thank you very much for the additional context. We are going to wrap up here in just a second. But one of the questions we've had come in here regarding, so the CDC is now saying that 5-day quarantine as opposed to 10, is sufficient. But apparently in their guidance on this topic, they've mentioned that their protocol includes if 5-day quarantine is not feasible. So like, how does that, the 5-day thing play into, does it have any effect on your recommendations? And somebody asked, what incentive would there be in that case for parents opting into this test to stay approach rather than maybe just keeping a kid at home?
Well, the 5 days that the child would be quarantined at home, or 10 days, or whatever it is that North Carolina decides to do, and the risk-benefit ratio around quarantine is very different for different patient populations, right? It's different for the elderly than it is for children. It's different for a school than it is for people who are exposed at Walmart, for example. So whatever it is that the State Board of Education and the state of North Carolina decide with respect to quarantine, you still get to avoid that by following the program. And importantly, for states outside of North Carolina, not only do you get to avoid that, but it further strengthens not only the concept of test to say, but the safety of test to say. And in school districts with less resources and fewer tests, you can do far, far fewer testing.
Sure, thank you very much. And one other question we had come in related to testing, there's been some reporting that rapid antigen tests maybe aren't as sensitive to Omicron as to other variants. Does that concern you at all with the implementation of this kind of test to stay approach?
It certainly warrants further investigation. And in fact, that's part of the reason that the test to stay research arm of this is going to continue in some of the masking districts and the unmasked districts. We will be looking at the performance of the antigen testing to further validate the findings of the study.
Sure, absolutely. Thank you, Dr. Benjamin. We are just about to wrap up here. There's been a little bit of confusion over some of the main findings here. So I'm just going to state this and let me know if this is correct, just so that everybody can hear it. The gist of your top level finding appears to be, from what people understand, that if there is a positive case in a school, then other students that are in contact with that person, briefly unmasked, don't need to quarantine, provided universal masking is in place and provided they can be tested in school from there out and remain asymptomatic and test negative.
That's correct.
Absolutely. Thank you. Wow. Well, this has been tremendously informative. Thank you, Dr. Benjamin, for taking time out of the holiday to share this with us. Obviously, school districts have got a lot to decide. We are going to wrap it up here. Thank you, everyone, for joining us. Thank you to Dr. Danny Benjamin for sharing your expertise. We will most certainly be back in 2022. And if you'd like to be notified about upcoming briefings, please email dukenews@duke.edu. Or if you're watching on YouTube, just like and subscribe. In the meantime, please have a safe and happy New Year's Eve, and maybe raise a glass to a much quieter 2022. Thank you very much for joining us, and everybody have a great and safe day.
Thanks, Greg.